Okay, so let's talk about Caroli disease, and let's start by looking on imaging or images. So Caroli disease is dilatation of the bile duct that are intrahepatic. You can see that we are looking on intrahepatic bile ducts. It's a congenital disease. You can see the normal bile duct, which you look, and this is how inflamed bile duct that is like dilatation cause. Now, there are complications to this dilated, inflamed, scarred bile ducts, as you can think about it. This can cause biostasis, and by that, complications like cholangitis and biostasis, so gallstones. So it can cause symptoms, but it not must. It can be even just focal. And if it's focal and cause symptoms, surgical removal of the area involved in the liver can be used as a cure, but if it's more diffuse, it's more problematic. Now, this, what I just described to you, is also called simple Caroli disease, just dilatation of the bile duct that are intrahepatic. Now, it can also be Caroli syndrome, meaning that if you look, for example, some images, you will see that, look for example of this one, you can see those hypodense dilated areas on the liver. Those are the dilated bile ducts areas. But if you look on all the image, you will see here a giant spleen. Now, what else can happen in Curry syndrome is congenital hepatic fibrosis. Now, congenital hepatic fibrosis causes fibrosis of the liver, and by that, it can just push and compress the portal system. By that, it can cause portal hypertension, and portal hypertension can cause hepatosplenomegaly. You can see here a giant spleen. I'm not sure it's because of this, but you can see how giant is the spleen in these images from Caroli. This is probably MRCP. This is, of course, CT. You can see here the dilated ducts, and here a very, very enlarged spleen. So portal hypertension can happen in Caroli syndrome, which is a secondary byproduct of what happened in Caroli syndrome. Caroli syndrome is exactly, again, like simple Caroli disease, but associated also with congenital hepatic fibrosis. This hepatic fibrosis can cause portal hypertension and damage to the liver. Now, a simple Caroli disease without this hepatic fibrosis, again, if it's focal, can be cured by surgical removal of this area in the liver, but if it's more diffuse, it's a problem. If it's Caroli syndrome, is also a problem. Now, what are the symptoms? Again, simple Caroli can be totally asymptomatic, or it can be symptomatic. If it's symptomatic, it's because of the biostasis and the scarring of the bile system, so cholangitis. And as you can understand, cholangitis can be come with pain in the right upper quadrant, fever, jaundice, pruritus, vomiting, all the symptoms of cholangitis, and cholecystitis, because it can also cause bile blockage, stones, and everything. Now, what is the treatment? As we said, if it's focal, you can remove it, but if it's not, you can give medications treating the cholangitis, urodeoxycholic acid, to try to just prevent stone formation, prevent the damage, or you can see surgeries, the procedure like internal bile bypass and liver transplantation can be also used. Okay. Now, about the risk for cholangiocarcinoma, you can understand that these recurrent inflammations that can happen in Caroli syndrome or even Caroli disease, those recurrent cholangitis, cholecystitis, recurrent inflammation is a carcinogen, so there is increased risk for cholangiocarcinoma in those patients, especially those that are with recurrent cholangitis. So this is the thing that I wanted to talk with you about on Caroli disease and Caroli syndrome. Let's call it simple Caroli disease and Caroli syndrome. Thank you very much. If there are any mistakes or correction, please tell me. And that's it for now. Thank you very much.